Folks, you know, and I'm going to fight to protect a woman's right to make her own personal decisions when it gets to her health care. I've also, for many years, and let me say this before you start to clap or boo, is that for many years as U.S. Senator, I've supported the Hyde Amendment like many, many others have, because there was sufficient monies and circumstances where women were able to exercise that right, women of color, poor women, women who are not able to have access, and it was not under attack as it was then, as it is now. But circumstances have changed. I've been working through the final details of my health care plan, like others in this race, and I've been struggling with the problems that Hyde now presents. It's become clear to me that to get universal coverage and to provide for the full range of health services women need, which I plan to do with the continued expansion of Medicaid and a public option of a Medicare plan, in that environment where providers like Planned Parenthood are under unrelenting attack, where we have a circumstance, and I want to be clear why I'm taking the position I have. So I make no apologies for my last position, and I make no apologies for what I'm about to say. The fact of the matter is that when, in fact, there is this enormous pressure and even threat to close down clinics that are available in the past for women who do not have the funds but are able to have them paid for privately, as we've been able to do, that was one thing. But we now see so many Republican governors denying health care to millions of the most poorest and most vulnerable Americans by refusing even Medicaid expansion. I can't justify leaving millions of women without access to the care they need and the ability to exercise their constitutionally protected right. If I believe health care is a right, as I do, I can no longer support an amendment that makes that right dependent on someone's zip code. But I want to be clear with you. I don't want to mislead you. If in fact it was still available, I think, just as I've never attempted to impose my views on anyone else as to when life begins, I have never attempted to impose my view on who should pay for it if people fundamentally disagree with the position we take. But folks, times have changed. I don't think these guys are going to let up. What's changed is, and Jesse and I talked about this in another context, when I got the great honor of receiving the medal at the Martin Luther King Museum. And that was that I don't think that most of us foresaw, I think Jesse did a little, but I didn't, that we would see a return of this viciousness, this notion of pitting people against one another that we are seeing now.